Hi, this is Dr. Chris Peters. In this segment, we're going to talk briefly about exercises and back pain because almost every day I'm asked by a patient, Doc, I've tried exercises. Why is it not helping my back pain? The first answer to that, I want to point out that many times back pain is actually due to a degenerated disc here. You can see that there's significant dehydration of the disc. And first and foremost, in the lower back, a majority of the time, about 60% at least, that will be the cause of the back pain and sciatic pain. And that has to really be treated first. You can see that it wouldn't make sense to just exercise a pinched nerve because that's not going to unpinch the nerve. So that's the first component that we deal with in what we call passive care. When we get done with that component, then we actually have to address a lot of times the long-term or the chronic cause of the back pain, which is related to the atrophy that we see here in these spinal muscles that a lot of times will occur as a result of an injury. Usually within 72 hours of an injury, these muscles, specifically in the spine, these are actually called the multifidus. They're also called the anti-gravity muscles. They're what actually holds you up all day long. And so they have to work all the time. They don't get to shut off. Sometimes even when you lie down, they don't. They will actually go into spasm. So many times that to properly isolate and target these muscles actually requires these guys here specialized equipment that's not commonly available called Med-X. Med-X is the only medical rehabilitation that's been scientifically and medically proven to target and to isolate those muscles. So although when a person's doing calisthenics on the floor, they may get a little bit of activation of these muscles, but they will get nowhere near the degree as doing it on a Med-X machine. And this has been verified by very brave college participants who were earning their degrees, where they actually had needles stuck into those muscles while they were undergoing rehabilitation and exercise comparatively to measure the difference. And so while a lot of times those may help some people, quite often they don't help everybody, and certainly they don't help anyone long term. And most importantly, they don't often show an increase in back strength relating to an increase in the muscle fiber diameter. So that's very, very important. It's something that is a complex issue, but it all boils down to a majority of all patients with neck and back pain, 90% in the scientific literature, has been shown to atrophy of these paraspinal muscles. Therefore, to properly address a person's neck and back pain, not just short-term but long-term, to prevent it from coming back, this has to be adequately addressed. Thank you for watching.